All right, let's talk about pre-colonoscopy prep. 360 Health has been conducting pre-colonoscopy prep Colonics for about 12 years now under the guise of John Biga and Bernard Chin from gastroenterology, and it's been an adapted elective procedure based on how things are done in the US, not intentionally as a part of their gastroenterology interventions, but we have had great results with patients who present with chronic disease or symptoms around epigenetics where they are at risk, and aging populations have showed interest in colon therapy as a preventative measure and also as post-care after the colonoscopy reports have been issued. What we found also too over the past 12 years is people are now using colonics on a regular basis if they are prone to particular conditions. So how that works for us on a long-term basis is how we can work alongside GPs. GPs are the switchboard of health in the Medicare system and in Australia in general, and we love the idea of continuing to raise awareness of colon-related health issues and how colonics can be, where required, through discussion in a team of healthcare providers, very intentional and dramatically changing the health and the performance of the colon in general. So the idea of what we want to propose to the medical professional world and other gastroenterology related industries is where colonics can be done leading up to a treatment, but specifically a prep alternate. The compound is nothing new under the sun, but it's issued and put together by a trusted chemist. So that gives us great confidence that if people do have sensitivities to the known prep issued by the government, if people are on the 4 or 5 year checklist, having a more gentler prep leading up to the treatment day is really handy. Also too, having a colonic 2 hours before the colonoscopy is conducted helps the tissue to be able to handle the effects of the colonoscopy. If people have had a rough response to the compounds that colonoscopy utilizes in general, they are relieved at the idea that there is an alternate procedure that can be conducted that helps the tissue become more plump, more supple and easy for the camera to pass through. The other side of it is it's quite comprehensive in removing any residue that's left over. Obviously this is dependent on how compliant somebody has been with the diet changes leading up to the procedure. So our idea around supporting gastroenterology and working with GPs and preparing people for colonoscopies is about the idea of a 3-day diet change and then significant 1-day diet change while they're incorporating the compound. We call it colon cleanse. If you're interested in the ingredients, please contact us. So we meet with people for about 15 minutes, about 2 weeks before their colonoscopy has been booked. We organise that chat so that they feel confident and capable of following the alternate diet. We also make sure the appointment is booked at that chat for 2 hours prior to the colonoscopy. We also make sure post-care that we follow them up. This is independent of the medical system, but our goal is to work as comprehensively and complementary to what is established in Australia as is. So the idea of what to do from here and moving forward and how the use of colonics can be more intentional is more along the lines of what's happening in Europe, in Russia in particular, not necessarily in the US, even though the model stemmed from integrative teams in the US. So we hope this information has been helpful, and if you have any questions about colonoscopy prep or any of our elective procedures, please contact us via the website, and we'll be sure to get back to you if you have any further questions. Thank you very much.